And without further ado, Making Exercise and Wellness, Part of the Cancer Experience with Carly Bailey, MA, and Brianna Castrogivanni, MS, RCEP. Carly Bailey is the Program Director for Exercise and Integrative Oncology at the Cancer Center. She is a graduate of the UNC's Chapel Hill's curriculum in exercise psychology, where she received her MA. After graduation, Carly gained experience as a research coordinator for exercise oncology studies at UNC, and then as the research and program coordinator at Cedars-Sinai with the Cancer Survivorship Program. In her current position at UNC, Carly serves as a liaison between physical activity programs like Get Real and Heal, the Cancer Center, and the community. Carly is a certified exercise physiologist and an integrative health coach. Carly, welcome.
Thanks, I'm glad to be here.
Absolutely. And what's one thing we left off there that we should know about you?
So I'm a novice gardener. I've taken up just light gardening in COVID, and this spring I decided to start everything by seed and turned my bathtub into a little greenhouse and didn't expect anything to work and ended up with over 40 tomato plants. So
wow.
I have a lot of tomatoes.
Oh my gosh. What's your favorite kind of tomato plant?
This year I planted sun golds and some random heirloom slicing tomato that I didn't really know much about. Just decided to try.
Nice, nice. We are huge fans. My wife is a huge fan of sun golds, so that's mostly what we've got going on. So good for you. That's awesome. All right, Bree, MS, RCEP, a registered clinical exercise physiologist through the American College of Sports Medicine and certified integrative health coach, working as a clinical research coordinator and health coach with the Lineberger Comprehensive Cancer Center. Bree graduated in 2016 from Sacred Heart University in Fairfield, Connecticut, with her master's degree in clinical exercise science and nutrition, and most recently completed her health coaching certification through Duke Integrative Medicine. Bree, welcome. Glad to have you here.
Thanks so much, Tim.
Absolutely. And same thing for you. What's one thing we should know outside of your professional bio there?
So I guess probably the most interesting thing is that I ran Division I track and field and cross country in college, and was sort of still doing some competing in road races and stuff before COVID, and yeah, now just trying to enjoy it for fun.
Wow, good for you. That's great. You think you're going to get back to the competition post as things start to settle down some more?
Maybe.
Yeah,
we'll see.
Yeah, very good. All right. Well, I mentioned poll everywhere. Our first question: exercise has no positive impact in patients' well-being during or after treatment. This should be kind of a softball for most of you. If you think that's true, go ahead and mark that, or false, go ahead and mark that, and then we'll come back to that in a minute. While you're doing that, this activity has been planned and implemented under the sole supervision of the course directors in association with the UNC Office of Continuing Professional Development. William A. Wood, MD, MPH, and CPD staff have no relevant financial relationships with commercial interests as defined by the ACCME. Carly Bailey, MA, and Brianna Castrogivanni, MS, RCEP, have no financial relationships with commercial interests as defined by the ACCME. All right. And here we go. Oh, we're already seeing a trend here on our poll everywhere. We'll wait just a few more seconds. We're seeing a strong trend. Carly and Bree, how are they doing?
Yep, that's right.
All right. Well, I will turn it over to both of you, making exercise and wellness part of the cancer experience.
Thanks so much, Tim. I am going to be starting our presentation off today. I am going to talk about the background. So what are the benefits of exercise? What are the ACSM guidelines? And what are some important things to remember in regards to exercise safety? And then Carly's going to talk a little bit about what resources we have here at UNC. And then she's also going to talk a little bit about how to engage your patients in exercise and wellness programs at your sites. So first we're going to take a look at the physical activity rates among cancer patients and survivors. This image here is from the Centers for Disease Control and Prevention, and it looks at the percent of cancer survivors age 18 years and older that reported no physical activity in their leisure time. And as you can see, in 2018, about 34% of those cancer survivors aged 18 years and older had reported no physical activity in their leisure time. And as you can see, this green line has been trending down over the years, which means that more. The ASM found in 2019 that about 33 to 45% of cancer patients are accumulating at least 150 minutes of moderate exercise per week. So what is exercise as medicine and what is ACSM? So ACSM is the American College of Sports Medicine, and it is the governing body for exercise professionals. And they created exercise as medicine as a global initiative to make physical activity assessment and promotion a standard in clinical care, and really to encourage healthcare providers to include physical activity when designing treatment plans, to refer their patients to evidence-based exercise programs and or qualified exercise professionals. So it's really a push to get exercise as a standard of care and to encourage your patients to get moving. So this image comes from a study done in 2018 by Clifford et al. And it is the barriers and facilitators of exercise as experienced by cancer survivors. And it was a mixed methods systematic review. And what they found was that the biggest barriers to exercise as experienced by cancer survivors were treatment-related side effects, poor time management, or just not having enough time to exercise, and fatigue. And fatigue is arguably, one of the most common treatment-related side effects. And about 25% of cancer survivors, years after treatment, still experience cancer-related fatigue, and it really affects their health-related quality of life, their independence or their ability to be independent and live independently, and also their ability to return to work. Some facilitators of exercise that were experienced by cancer survivors were that they felt an improved physical health when they exercised. They felt an improved mental well-being. They also felt this control over their health, like they had control. And then the social benefits as well, and the social benefits that are experienced in group exercise or even just exercising with another person. So what are the ACSM exercise guidelines for cancer patients and survivors? So the most important thing to remember is just to avoid inactivity, to encourage your patients to just move their bodies within the limits of their side effects, and just knowing that a little bit of something is better than nothing, and that just avoiding inactivity is really beneficial. So depending on what kinds of, what their limits are and what they're able to do, encouraging them to take the stairs instead of the elevator, or encouraging them to park a little farther away at the grocery store so they're walking some extra steps. Or maybe you're encouraging them to get a fitness tracker and track their steps and help encourage them to move. So just really encouraging them to move their bodies a little bit is better than nothing at all. And then 150 minutes a week of moderate intensity aerobic exercise, or 75 minutes a week of high intensity aerobic exercise. And then the resistance training 2 times a week, working those major muscle groups. And something really interesting about these guidelines for cancer patients and survivors is that they're exactly the same guidelines as they are for the healthy population.
All right, and we've got our first full poll everywhere question. What is the minimum number of minutes that aerobic exercise should be sustained in to count towards the overall goal of 150 minutes? And would that be A, 10 minutes, B, 30 minutes, C, 15 minutes, or D, any movement counts. And so thank you so much to everyone who's already responded. You all are jumping right in there. That's wonderful. And just take a few more seconds. Bree, how are they doing?
They're doing good.
Good.
So the answer is D, that any movement counts. And that is sort of bringing home that point of just avoiding inactivity, and that any little bit of movement counts towards that 150 minutes. So if your patient can only walk down their driveway to their mailbox and back once or twice a day, that counts towards their 150 minutes. And the original thought was that a person needed to have sustained physical activity or sustained exercise for at least 10 minutes for it to count towards that 150-minute goal. But as of 2018, when the ACSM came out with these new guidelines, they came out and said that any movement counts, and just encouraging your patients, to move. And that 150 minutes doesn't have to be the goal right away. It can be a long-term goal that they work towards over time.
Terrific. Thank you so much.
So what are some important things to remember when you are you want to refer your patient to an exercise program or an exercise professional when thinking about exercise safety? So if your patient is at a high risk for falling, which means that they have 2 or more criteria that may put them at risk for falling. So they may be over the age of 65, they may use an assistive device like a cane or a walker, or maybe they even use a wheelchair. They're on any medication that may increase their risk of falling or dizziness. They have a history of falls, or they've fallen recently. They have peripheral neuropathy to their feet or their toes. Any of those sort of criteria may put them at risk for, a higher risk of falling. If they have any uncontrolled comorbidities, so high blood pressure, atrial fibrillation, or diabetes that aren't being medically managed, or any known cardiotoxicities that also are not being managed, need to be, and then if they're moderately to severely cognitive. So if your patient falls into one of these categories, medical clearance is definitely needed before starting an exercise program or working with an exercise professional. A supervised exercise program, preferably a small group or even a one-on-one with an exercise professional, is definitely safer. And then remembering that physical therapy may be a good bridge to get your patients from this point to being able to exercise either unsupervised or in a large group setting. And physical therapy is really there to help correct impairments and limitations that may prevent your patient from being able to work towards those ACSM recommendations. And then for all of the exercise professionals out there, remembering that health-related fitness assessments can be really valuable. Some examples of these are the 6-minute walk test, gait speed test, a short physical performance battery, the timed up and go, and the bird balance. So assessing a person's balance and strength and endurance, really function overall is really important before getting them started in an exercise program. So what can exercise do? So exercise can help prevent 7 common cancers. So bladder, breast, colon, endometrial, esophageal, kidney, stomach cancers. And it can also help with the survival of 3 cancers: breast, colon, and prostate. And so what else do we know about exercise? So we know that there's strong evidence to show that exercise can help improve cancer-related fatigue, health-related quality of life, physical function, anxiety, depression, and is safe for people that have lymphedema. And strong evidence in the context of this ACSM roundtable that they did, strong evidence came from at least 5 or more randomized controlled trials. And in those randomized controlled trials, at least 150 or more participants. So how much exercise and what kind of exercise is needed to be able to see these benefits. So in cancer-related fatigue, doing aerobic exercise only 3 times a week for about 30 to 60 minutes, or resistance training only 2 times a week, working those major muscle groups, 2 sets of 12 to 15 reps. But a combination approach of aerobic and resistance training together gives you the most bang for your buck and gives you the most benefit. And that's really going to be the same for health-related quality of life and for physical function. So you're going to get some benefits in aerobic only. You're going to get some benefits with resistance only, but a combination approach is really going to give you the most bang for your buck. For anxiety and depression, you're going to see really good benefits in aerobic only, so 3 times a week, 30 to 60 minutes. There's not a lot of evidence to show that resistance training only can help with anxiety and depression. But again, with anxiety and depression, a combination approach of aerobic and resistance training together gives you the best benefit. And in the context of lymphedema, this was only in breast cancer. So lymphedema related to other types of cancers, there's just not enough research out there to show how exercise can help or if it's safe for other types of lymphedema. But lymphedema specific to breast cancer is safe, and the exercise does not exacerbate lymphedema if you're doing resistance training 2 times a week. A slow progression and most beneficial in supervised programs. And for most of these outcomes, a supervised program was shown to be better than an unsupervised program. And there's some moderate evidence to show that resistance training may be beneficial to bone health, specifically load-bearing exercises. So if you're doing anything like walking or body weight squats or lunges, anything like that, loading your bones may have benefits for that, for bone health. And then there's some evidence to show that aerobic exercise only may have some benefits with sleep. You can go ahead to the next slide, Tim. Thank you. So this image is basically everything I just said, but I like it a little bit better, and it's a little easier to understand. And this would be a really awesome image to show your patients in clinic. And it walks them through moving through cancer and how to get started, that point about just avoiding inactivity and moving a little bit more and sitting a little bit less, how much exercise that, they should work up to, and, what are the benefits. And then that same point about a combination approach being best with some of these outcomes as well. So what are some special considerations when referring your patient to an exercise program or for any exercise professionals here today? So if your patient has bone mets or bone loss, it's going to be really important that they avoid any high impact movements. So jumping is a high impact movement. And before working with a patient that has bone mets or bone loss, you want to find out where are their bone mets, and are they having pain with weight bearing exercise. So if your patient has bone mets in their lower body, asking them if they have pain when they're walking or when they're doing weight bearing exercise. And if the answer is yes, then trying non-weight bearing exercise instead is probably safer and will be more beneficial for them. So non-weight bearing exercise, examples of that might be using a recumbent or a stationary bike, or a new step machine, or maybe even an arm ergometer if you have access to that. If they don't have pain with weight bearing exercise, light walking can be okay. If they have bone mets to their spine or their ribs, avoiding any hyperextension or really hyperflexion of the spine, which would be like a crunch or like a sit-up, and then avoiding any dynamic twisting movements like going side to side. If they have bone mets to the upper body, just avoiding maybe any overhead weighted exercises, and really just asking your patient, how their pain is and what they're comfortable doing. If your patient has lymphedema, this may be a controversial point here, but the research shows that there's really insufficient evidence to support or refute the clinical advice of using a compression sleeve while exercising. I've always been told to make sure my patients are wearing their sleeves, and I really just refer to the patient's provider for guidance on this. And that's really what the research says as well. So just refer to the patient's provider for exercise safety if they have lymphedema, and that's specific to breast cancer. So if you're working with older adults, so older adults over the age of 65, we know that in our older adult population, comorbidities are really common. Sarcopenia, osteopenia, osteoporosis, cognitive decline, fatigue, neuropathy, and understanding that cancer can really accelerate these comorbidities. So it's really important in this population specifically that as an exercise professional, you're doing health-related fitness assessments before starting them in an exercise program. You're understanding what their balance is like, what their gait is like, what their stability is like, what their endurance is like. And you're able to modify exercises to best meet their needs while also working on their balance and their flexibility and areas that they may be weak in. If your patient has an ostomy, you want to make sure that they're emptying this before they're exercising. They're avoiding any contact sports, so anything that might result in a blow. And if they're interested in resistance training specifically, it's definitely safe and advised for them to work with an exercise professional or work with under the supervision of an exercise professional. And this is so that way the exercise professional can ensure that that patient is lifting or doing resistance training with proper form. So they're avoiding the Valsalva maneuver, which means that they're holding their breath while they're lifting. They're modifying core exercises as needed, and they're really ensuring proper hydration for anyone with an ostomy bag. Peripheral neuropathy. So depending on if the person has peripheral neuropathy to their hands or their feet will sort of determine what exercises you sort of choose in your exercise prescription. In peripheral neuropathy to their feet, the biggest thing is that they're at high risk for falling. So assessing their balance, assessing their stability, assessing their gait, and then really working on these exercises that help with this is going to be really, really important. So incorporating balance exercises and maybe even educating your patient on exercise safety. So in a patient that has pretty severe peripheral neuropathy to their feet, a treadmill is definitely not a good idea. Even walking on an uneven surface. So sometimes sidewalks can have cracks and little bumps, and that could become dangerous as well. So maybe considering non-weight bearing exercise in this population may be safer. So again, non-weight bearing exercise using a recumbent bike, a stationary bike, maybe a new step machine, maybe an arm ergometer. And then when considering resistance training, machines versus free weights, normally I would always pick free weights, but for this population, machines may be safer. And that way they're sort of in a fixed machine, and in case, they're holding onto free weights and they were to drop them. So machines may be a better choice in this population. And then remembering as an exercise professional that we can use things like hand gloves to help our participant grip onto machines if they have peripheral neuropathy to their hands and are having a lot of pain, as well as we can use foot straps as well. So there's a lot of ways that we can modify exercise for this population. If your patient just had a stem cell transplant or is getting a stem cell transplant, it's really important to encourage home-based exercise programs to keep them safe. And if you're working with a patient that just had a stem cell transplant, you really want to focus on their exercise being light intensity and high frequency. So what does that mean? If I'm working with a patient who just got a stem cell transplant and they're still in the hospital recovering and I'm going to prescribe them some exercise, it might look like 5 sit-to-stands 5 times a day, just one set at a time. And that's really going to encourage them to maybe get up a few times during the day, move their bodies a little bit, get in a tiny bit of exercise, but at a really, really light intensity. They're only doing one set. And it's important to progress this group either really slowly or not at all. And to remember that they're going to feel differently every day, and to really be able to modify their exercise on a day-to-day or maybe week-to-week basis, and asking them how they feel and what they're comfortable doing. If your patient is neutropenic, no exercise if they have a fever, and no exercise if their platelets are below 10 to 15K. So, and you can click it one more time, Tim. So what do we know? And is exercise beneficial for cancer patients and survivors? And the answer is yes. It is safe and it is definitely beneficial. And so during treatment and after treatment, programs should include really the same things across the board: cardio or aerobic exercise, strength or resistance exercise, flexibility, and balance. And during treatment, you want to progress your patients really slowly or have no progression at all. And after treatment, same thing, nice and slow progression, and really just focusing on how they're feeling day in and day out. You're going to get all of the same or many of the same psychological and physiological benefits across the board with exercise. And then just being mindful of some of those special considerations that I talked about earlier. And then remembering way back in the very beginning of the presentation when I talked about the barriers of exercise. And the biggest barrier was treatment-related side effects. And we know that exercise can improve or help treatment-related side effects. So again, just reminding your patients that it's safe to exercise and just to move their bodies a little bit within the context of their symptoms.
All right, and here we are with our next poll everywhere question. A patient comes to clinic struggling with fatigue, anxiety, and pain. You decide to mention exercise to them as an alternative way to manage these symptoms. What is the appropriate place to start? A, suggest they start exercising 30 minutes a day. B, suggest they start a weightlifting program. C, suggest they start moving a little bit within the limitation of their symptoms. Or D, provide them with education about benefits of exercise in the context of their symptoms. Or finally, E, which is C and D. And looks like a lot of you have already answered. Take maybe just another 5 seconds if you haven't had a chance. All right, Bree, seems like we're settling on E. How are they doing?
Yeah, that's great, and that is the answer. So yeah, you just want to suggest that they start moving a little bit within the limitations of their symptoms, and then providing them with education about the benefits of exercise. And I would also argue that, you know, the third point here would be to see if they're interested in an exercise program or getting started in exercise, and then referring them to either an evidence-based exercise program or an exercise professional.
Great, thank you so much.
Thanks so much, Bree. That was super informative. And I'm Carly. I'm going to spend some time talking to y'all today about the resources that we have available at UNC, and then also, if you're not a UNC person, what you can do at your center, or if you are a UNC person and just your patient isn't interested in our programs, like how you can motivate your patients to get up and moving. So the first program I want to talk to you guys about today is called Get Real and Heal. This is a program that we've had for a while at UNC. It's a 16-week program that provides small group exercise programming that focuses on aerobics, strength, flexibility, and balance training 3 times a week. We are open to all cancer patients regardless of their stage of their disease, their diagnosis, or their treatment type. Our program is free. And we do require an oncologist medical clearance for this program. And we do a baseline physical assessment so that we can really get a picture of where they are at the beginning of our program, and also make sure that we're able to meet their needs and that it's safe for them to exercise with us. COVID derailed us, of course, and we were able to launch a remote program. And so now we're currently doing all of this programming on Zoom 5 days a week. We offer 7 classes a week, and everything gets recorded. And so we're recording things and posting them on a closed Facebook group, but also off Facebook, so people who aren't into Facebook can still access our workouts at any time. We are accepting participants still, and we're planning to continue our remote programming even once we're able to be back in person, and we're doing our in-person programming still. And just like our in-person program, our remote program is also free. We're also really grateful to have a health coaching program here at UNC. This is a research study that's it lasts for 6 months, and the goal is to improve or maintain physical function during or after cancer treatment. This program is really great for patients who just need that little bit of extra support. They need the one-on-one contact of a health coach. Maybe they're interested in exercise, but also have some other domains of their health that they're interested in working on. The criteria for being in this study is that they have to be English speaking and have a 6-month life expectancy. They have to have a cancer diagnosis. We accept all diagnoses, all stages, all phases in treatment, even into survivorship for this program. Participants are given a Fitbit and paired with a health coach, and they take surveys every week around how they're feeling and also what their physical function is like. They get weekly coaching and goal setting. So it's a really great program for people who just need that little bit of extra support. We take all of this information that we collect every week from the coaches and the surveys and the Fitbits, and we put it into a report that goes into our medical record system called Epic. And Tim, on the next slide, I show a picture of what that looks like. So this is what our reports look like. The whole idea behind these reports is that as a research study and a program, we want to make sure that clinical teams are up to date about what's going on week to week with their participants or with their patients, because we know that not all patients see their clinicians every week. And we also know that sometimes participants are telling the coaches things that are important for the clinicians, but that they might not be telling the clinicians, whether that's related to their physical health or their emotional health or their like social situation. Sometimes we get information that's important to let people other than us know about. And so we do that in the form of these reports. We have a yoga program because we know that yoga is really beneficial when it comes to reducing fatigue, managing depression and anxiety, improving sleep, and also improving quality of life. These data are really robust in breast cancer patients, but we know that these benefits are there for many different cancer types. So our yoga program is open to everybody, regardless of treatment type or diagnoses. We offer 3 days a week, pre-COVID, in a physical studio, in a small group. Now we're offering this program 5 days a week over Zoom, and we don't record these, so participants do have to be able to attend our live classes to get the benefits from yoga through our program. This program is also free. We don't ever turn anybody away. When people start, we suggest a $5 donation per class. And so some people do that and others don't, and we don't really ever follow up with people who aren't doing it because we don't want the cost of our program to be a limiter for people who want to be engaged with our program. So we know that wellness encompasses lots of different domains. So exercise is one of those pieces, and arguably exercise really affects lots of different domains of wellness. But it's important to note that when we're talking about wellness, that we're including lots of different things, and wellness means lots of different things to different people. So it includes things like stress management and nutrition and having a community around you. Also, your spiritual and emotional well-being and your sleep hygiene are all things that can be related to a patient's wellness. And I just wanted to make sure that it was clear that this next phase of the talk really encompasses wellness and exercise both. So how in the world do you get your patients up and moving? Like, it's really easy to say like, hey, you should be exercising, but then what? So I'm going to spend some time talking now about how to actually engage patients in this process. So at UNC, we have an order in Epic. So you just search for ONCX and place this order. It comes to me, and so I follow up with these patients and help get them involved exactly where they need to be and where they want to be involved. And so it's a really easy way for clinicians to just connect patients, offload the work of figuring out where to send a patient for exercise onto me, and then I'll take care of it from there. This is a great thing because you as a clinician and as a provider can select what programs your patient is interested in at baseline. Also, you're able to indicate any concerns that we should know about when it comes to their ability to exercise. And then this also serves as your medical clearance. So some of our programs do require medical clearance. And so this, if you do it this way, it takes out the step of you getting an email from me asking if it's okay for your participant to participate with us. So this is what it looks like filled out. So you can really see how it looks. And then we've got that third box on that exercise program row where you can just indicate if there's something else that they're interested in or some kind of specific need that your patient might have. So I know that not everybody is here who's here is part of UNC. And so I want to back up a little bit, and we're all going to dig way deep back to college, maybe even high school, when you had a class about psychology and behavior change. And we're going to go through the transtheoretical model of behavior change because it's really important when you're having conversations with your patient to be able to have some idea about where they are in this process. So Tim, I have some animations here. I'm sorry. Thank you. So the first stage is called pre-contemplation. This is the stage where like your patient isn't even aware that making a change is important. They haven't even thought about it. It's not even occurred to them. Most patients are sort of out of that already. Contemplation is the phase where we find a lot of our participants. This is the phase where they really know that they should be giving up those energy drinks, or they really should be walking more. But there's always that big but. This is the phase where the barriers are really big. And so this is the phase where we find a lot of folks. And just because a participant or a patient has barriers, that doesn't mean that they can't keep moving forward and address those barriers. And later in the talk, we're going to talk a little bit about how you as a clinician can help your patients address barriers and sort of work through that. But I just want to point out that just because a patient has barriers doesn't mean that they're not valid. You know, being strapped for time is a real issue for a lot of people, and that's a real thing. And so, you know, being able to address that and for your patients in this phase is really important. The next phase is preparation. So this is the phase where your patient has started making grocery lists and is leaving off energy drinks, or they have bought the new shoes and they are excited about getting to walking now that the weather is warm. So this is a pretty short phase. It's important to note that patients can move backwards and forwards here. So sometimes people spend some time in preparation, but then slip back into contemplation because they encounter a barrier. For patients who are in action, these are the ones who, when you say like, hey, have you considered exercise to help with your symptoms? They look at you and say, yeah, I exercise 3 days a week for an hour. You know, these are the people who are engaged in the behavior. They're spending their time and energy figuring out how to make it work for them. These are the people who might need support when it comes to making sure that what they're doing is sustainable. But there are a lot of people who are engaged here in action. Then we get into maintenance and termination. So you have to be in action for at least 6 months to be considered in maintenance, and then maintenance for at least 6 years. Termination is when there's no risk at all of ever going backwards. The new behavior is really deeply ingrained into your routine.
All right, and with that, our next poll everywhere question. The trans-theoretical model of behavior change allows forward and backward movement. A, true, or B, false? And just take about 8 seconds or so, and then we'll see how they're doing. Right, Carly, pretty serious trend towards true. Is that what you're looking for?
Yep, y'all nailed it. That's exactly right. People move back and forth in between those phases, and that's one of the really powerful things about the trans-theoretical model, is that you're not locked into one space. So how do you sort of figure out where to start with your patient? And really the best place is just to ask some questions. So if you're thinking about encouraging some kind of behavior change when it comes to exercise and wellness with your patient, the first question to ask is, what do they like to do? You know, if you're going to suggest exercise, following it up with like, what do you enjoy? Is a good question to ask. Tim, can you click for me, please? Thank you. So if your patient is like really firmly in that contemplation phase, you know, when you mention exercise, they say, yeah, I would love to do that, but I work, or, but I only like to walk when it's 75 degrees and sunny. You know, they have barriers that are in their way. Helping increase the importance of whatever this behavior that you're suggesting is a good place to start. And also helping them to imagine what their life could be like if they actually were doing that behavior. So if they were fitter, if they were stronger, if they had better nutrition, you know, whatever you're trying to help them implement. If your patient is in action, the best place to start is making sure that they have what they need to be successful. So if your patient is actively engaged in the behavior, just ensuring that they're not relying on their neighbor who is actually going to be moving next week to go on those walks every day. You know, they have what they need to continue to be successful. And then just the whole point of asking these questions is to just inspire some hope and motivation in your patients. And also, when you think back to those facilitators of exercise that Bree was talking about, one of the things that was really important was having patients feel in control. And so when you are going through this process with your patient, you can know that by asking these open-ended questions, it's putting the control back in their lap and letting them be in charge of what comes next for them. So after you have done that, you can spend a few minutes setting SMART goals with your patients. And this is done best in a collaborative spirit. So you as a provider sort of helping them make sure that their goals are relevant and attainable and make sense in the context of your patients' lives, but are really led by your patients. So Tim, if you'll click for me. This is an example of a SMART goal that you and your patient might come up with together. So until my next appointment, I'm going to walk 3 days a week for 20 minutes. And so your patient would not only leave your office with some idea about what's coming next for their cancer care, but also a goal that they developed in collaboration with you that's going to help put some of the control when it comes to their health and wellness back in their own hands, which is a really powerful thing for your patients. So I want you all to recall that the call to exercise is medicine is really for all clinicians to include physical activity when designing treatment plans. So these conversations can really come from anybody on the clinical team. Tim, do you mind clicking for me? I'm sorry. So anyone who's having conversations with patients about their health and well-being can have these kinds of open-ended conversations where the patient is really in charge about what they're going to do when. And so I know that everybody is busy and that clinics are really, really busy. And so these conversations can take anywhere from 2 to 5 minutes. They don't have to be long, and they even just sort of planting the seeds for your patients about what they like to do and giving them the framework about how to do it is a great place to start. And I also don't want to discount the importance of education and providing resources, because I think that a lot of our patients just don't realize that everything that they do, doing something is 100% better than doing nothing. And so I think helping people reframe, like, they don't have to run for it to count as exercise. They can walk to the end of their mailbox, to the end of their driveway and back, and that counts. Pointing patients in the direction of community resources like the Live Strong program at YMCA or other community cancer support programs is also a great thing. Enlisting the help of caregivers can also be really powerful for patients, just to have that buddy and that accountability, and having somebody else saying, we should be doing this together and it's good for both of us. Or providing patients with tracking resources, whether that's encouraging them to go purchase a fitness tracker or encouraging them to journal their progress about how it's been going, and writing those goals down and keeping physical documentation about how it's going on their journey to health and wellness can be really great.
All right, and I think this is our last poll everywhere before our audience gets to ask their questions. So a combination approach to behavior change can be beneficial. What combination tends to work best? A, telling the patient what to do, then making a SMART goal for them. B, asking motivation-based questions, then collaborating with the patient to create a SMART goal. C, telling the patient what to do, then letting them create their own SMART goal. Or D, providing education, then telling the patient what they should do. And take another 5 or 6 seconds here. Several of you have already landed on one particular answer. Carly, looks like we're focusing on B, asking motivation-based questions, then collaborating with the patients to create a SMART goal. How did they do?
Definitely, that's it. When I was thinking about this question, I hoped that it wasn't too tricky, because that collaborative spirit and really engaging the patient in a way that gets them thinking about their own health and well-being in a new way can be a little bit unfamiliar. And it's always easiest to tell somebody what you think they should do. And so sort of stepping out of that and remembering that your patients are the expert on themselves, and that they really know their own health and well-being very intimately, and that's an important thing to honor with our patients. So I think we're going to skip the case study and just go straight to questions, just in an interest of time.
All right, and I need to take care of something on my screen here to make that happen. And while we're waiting for those questions to come in, I have one of my own. I'm guessing that there may be different groups that may respond to some of these different strategies differently. For instance, are there some differences in the way you would apply this to an AYA population as opposed to an older group of adults? And if so, what might those be?
So I think that tapping into somebody's motivation is really the same for AYAs versus older adults. Like, everybody has their own intrinsic motivation that can be tapped into and can help themselves drive towards their own best health, right? I think that the way that you approach the different age groups is a little bit different, and there's just some nuance there, but I do think that it's really the same, that the guidelines are the same. Like, we know how much exercise patients need, and we also know some ways to help people really tap into their own intrinsic motivation.
Great. Thank you so much. Next question. They're starting to come in from our audience. Thank you. And again, we have a few minutes, so please keep those questions coming. First, can social workers refer to ONCX?
I think so. If you find that you can't, you can message me in Epic or email me, and we'll figure it out together.
All right. And next question. And this isn't popping up yet, but it should in a minute. It says, hi, Bree and Carly. I have a couple of questions. Are there here we go. Are there ACSM guidelines for stretching flexibility different for patients in this population for the Get Real and Heal program and Health Score program? Do you track down how patients come to know about the programs? If so, what would you say is how the majority of patients learn about them?
So I can answer this one, or I can start. So the ACSM guidelines for stretching and flexibility are essentially just to stretch major muscle groups typically on the same days that you would exercise, and then just being mindful, does your feet have a port or a line? So just sort of being mindful of those, but stretching major muscle groups on the same days that you do your exercise is the guidelines, and it's the same for healthy adults as well. And I can speak specifically to Health Score. We do track how our patients come into our program and how they find out about our program. The really interesting thing is I think about 95% or more of our patients are actually referred by their provider. So a lot of the providers at UNC know about Health Score and have patients that are already involved and send Carly or I referrals through Epic for their patients. So most of our patients for Health Score are referred directly through their providers, and then I call them, and usually they already know a little bit about the program by then.
Great. And I apologize. I just threw out a term a minute ago, and I'm going to ask you, one of you or both of you, in answering the next question, to also define AYA, because I think I threw that out there without defining that. So do you offer an AYA program? How young? And if you can also provide a definition on what AYA is.
Yeah. So AYA is adolescent and young adult, and for the health coaching program, we can send patients as young as 13, I believe, 15. For Get Real and Heal, we would just make case-by-case assessment on if a patient is appropriate. We have some people who are definitely under, who are like 16, 17, 18 involved currently.
Okay, good to know. I'm a CEP in Wilmington, North Carolina, and we just started a cardio-oncology rehab program here in December. How do you structure the exercise portion of your program, similarly to how traditional cardiac rehab programs run? And how do you approach prescribing exercise to such a wide range of diagnoses? I would love to connect via email too, if possible.
We should totally connect via email. In general, so for all of our programs, we include aerobic and strength training. We encourage flexibility and also balance training. So Get Real and Heal, we do like one standardized workout and then modify it based on people's needs. For the health coaching program, it is truly individualized and patient or participant driven. So the participants come up with their own goals under the guidance of their health coach.
All right. And what about post-operative patients? How soon should they begin exercising?
As soon as their oncologist says you should be exercising or you can exercise. That's really the importance of the medical clearance, like making sure that the provider teams are on board with their patients being involved. Occasionally we'll have some patients who need to pause because they have surgery in the middle of their participation, and then they come back after their surgical team says it's okay.
Okay, and can you tell us again where we find the results? I'm looking at a patient chart and cannot find it.
Yeah, that's a great question. Some of our patients, our program is going through some iterative changes right now, and we're shifting systems towards a program-specific website. And so we're still working on the workflow for getting those reports into a patient's chart 100% of the time. It's coming, and it's going to happen here in the next, I would say, couple weeks. So if your patient is newly on study or has been on study for a while and doesn't have any reports, that's probably what's going on. Sorry about that.
All right. Oh, that's okay. Thank you. All right, we've got 4 more questions, so we are hitting the hour. So thank you for sticking with us. We'll take these last 4 and then start to wrap up. So, can exercise prevent the production of seroma after a partial mastectomy?
That is an excellent question. I'm going to have to go back and look at the literature to see if I can figure out the answer. Bree, do you happen to know off the top of your head?
I'm not sure.
All right. And then this and then this next one, I cannot find the report in EPIC. Can you show it again? That kind of gets back to what you were talking about earlier.
Yep. So
Okay.
it's coming. If you want those reports via email in the interim, we can totally send them to you via email. Just email us and let us know.
Okay. And then the last one, exercise suggestions for cancer patients who have significant peripheral neuropathy in the feet.
Yeah. Recumbent bike is awesome. New step is awesome. I would definitely encourage them to do strength training that's supervised, just to keep those muscles working and help those neurons really like come back. There was a paper relatively recently that talked about exercise and peripheral neuropathy in the feet and how exercise does make a difference over time. So it does come, but I mean, the biggest thing to look out for, like I would definitely not put them on a treadmill. I would not put them on elliptical. If they have access to a pool and it's safe for them to be at a pool, that's a great option too.
I know I get inundated with the ads for the rowing machines. Is that another one? Is that one that would be beneficial?
Rowing is great. Yeah.
Okay. Wow, what a great set of questions. Thank you so much to everyone out there asking those. Glad we could get to so many of those. And let's go ahead and do some wrap up. We want to say thank you to Mary King, Veneranda Obore, John Powell for all the hard work that they do for each and every one of these lectures.